Another mistake that therapists sometimes make is not interrupting clients enough or interrupting them too much. Some therapists have been taught that it's not polite to interrupt clients. And here's how I phrase it to them. If you don't interrupt clients and guide the session in a way that's going to be productive, you're really depriving the client of getting the most from the therapy session. Therefore, it's very important to just gently interrupt clients. You can just say, "Oh, can I interrupt you for a second?" Now, it's also important to watch the client's nonverbal behavior and also to listen carefully to what clients are saying, because it may be with some clients that they find the interruption an annoyance. But you should be able to pick that up if you're watching their body language, you're watching their facial expressions, you're listening to the tone of their voice. And when you suspect that they've had an affect shift, then maybe they are feeling more annoyed, it's important for you to ask, what's going through your mind right now? And if the client says, well, I think you're interrupting me too much, then the first thing to say is, it's good you told me that. And then you can just work out some kind of compromise with the client. You might say, how would it be if maybe for the next 10 minutes or so, I don't interrupt at all? And then at the end of that time, what I'd like to do, if it's okay with you, is to summarize what you've said so I can make sure that I really understood you correctly. And then maybe we can figure out one problem from the things that you've told me to focus on for the rest of the session. How does that sound? They don't know what level of detail you need and what you don't need. It's important for you to guide the session and interrupt them gently so that you can get the information that you need to plan how you're going to have the most effective session.